many more nurses and doctors are you targeting, say, for the next 2 weeks?
Oh, well, we have a staff of 2,500 people here. Plus, we are going to be vaccinating our colleagues over at the UHWI and also our clinical medical students and our nurses who are clinical students and all our clinical students. So that would be pharmacy students, physiotherapy students, all of those who are rotating through the hospital. After that, we will get to our retired people.
This is the registration area. This is where they come and they register and they fill out they do it by appointment. So, you know, they tell us what the appointment is and they take the temperature, write it down, and they fill out forms. This is the pharmacy booth. So they are the ones that write down the time that the vaccine, the batch number of the vaccine, and they write the expiry date of the vaccine and all that information on a card, which every person that take the vaccine, they get that card. Okay. These seats is where we have the persons after they're finished registering. They come right here and they sit down and we call them into the different cubicles to get the vaccine.
Do you have any idea how much person you vaccinated yesterday?
Around 500.
And how much since morning?
Not more than 50.
Okay. So everything is running smoothly so far?
Yes. This is a cubicle, you know, there's a person using the vaccine at the moment. That's an infection nurse. That's a public health nurse right there. Let's give the vaccine to them. So after they receive the vaccine, take them to the seats right here to be observed, because we observe them for 15 minutes. If they have a reaction to the vaccine, they'll come right here.
Has there been anybody showing any?
No. As I was saying, this is the observation booth. So they sit down right here and they have to wait 15 minutes after they take the vaccine for us to observe them. And they also go to the community health aid over there where they take the information from them and register it in a book.
Being in the emergency department can take a toll on you, because at the end of the day, you know, a lot of cases coming in and you don't know what it may cause on you yourself. So I personally decided long ago that I will take the vaccine, because at the end of the day, it's to protect us, to protect our country.
Tell me about your hopes for returning to normalcy.
Well, trust me, I would really like for it to come back to normal, because you know, people can more socialize and all of that, and you know, we as a nation, we very friendly and stuff, and you know, being in this pandemic, make you have to stay away from people. So, yeah, I'm just hoping for the best.
At first, I was really very nervous, a little bit nervous after, because you know all of the things that you hear. But I've been listening to various things talking about the safety of the vaccine and how it works, and it was very encouraging and settled some of the fears that have been out there, and so I'm not too afraid.
How have the stresses of COVID affected your personal life?
It has really been stressful. Just trying to interact with your family like you usually would, it's very hard, because I don't even hug my parents much, and that's very hard for me. So it's really not easy being in the hospital, actually working with patients who have it, and the stress that is taking on them. It's also very hard to witness.
Initially, hearing about the vaccine, you'll have mixed emotions. You're gonna wonder how quickly was this vaccine developed? Is it safe? The side effects, all the things that the general public would think about. But then I was on maternity leave for some time, so I read a lot of information on the vaccine. So I decided that once the vaccine gets to Jamaica, I'm gonna take it, because comparing the countries, the persons in other countries who have taken the vaccine, I'm not realizing that their COVID rates have actually been going down. So I'm saying if the same thing can happen to Jamaica, maybe we stand a chance of eradicating this pandemic.
And what does this first shot of the vaccine signify for you?
For me, it gives me a little sense of calm knowing that, okay, it's not that we're saying that getting the vaccine will prevent you from contracting the virus at all, but it's telling me that, all right, if I should get the virus, then the chance of me ending up in ICU or dying is lessened. My body can actually put up a better fight against this virus. If the majority of persons come on board and take this vaccine, I feel like we may have some sense of normalcy in the near future, near being a year or two. However, if Jamaicans continue not really taking this thing seriously, I think it's 50-50. If our mindset change, maybe the next year or two we'll be back to normal, or as close to normal as is possible. If we continue on the path that we are right now, it's probably going to be a longer time.
Well, I wasn't worried about the vaccination process because as a physician, I understand how it is to prevent infectious diseases, and I know that vaccination that we have in our population, especially our children, actually has been a very effective way for preventing infectious diseases. So I was aware of the concept and the success.